The Food and Drug Administration has approved the first oral treatment for postpartum depression. It's a once-a-day pill approved for women called zuranolone. It can be taken after childbirth or the later stages of pregnancy. Postpartum depression affects an estimated 15% of women in the weeks or months after having a baby. Before this, the only approved option for treating postpartum depression had to be administered as an IV infusion. So the drug will now need to clear a 90-day Drug Enforcement Administration scheduling process before it could enter the market. How significant is this? For more on the story, let's welcome in Dr. Carole Lieberman is a Beverly Hills psychiatrist and best-selling author. And welcome to you both. Thanks for coming on today. For those who might not be fully aware of postpartum depression, I just wanted to share this with our viewers here. It's defined as the time after childbirth. Most women get the so-called baby blues or feel sad or empty within a few days of giving birth. For many women, the baby blues go away in 3 to 5 days. If your baby blues don't go away or you feel sad, hopeless, or empty for longer than 2 weeks, you might have postpartum depression. And Carole, when you think about what that could be like, there would be a lot of newness if you're bringing a new life into your home, and there's a lot of stress and anxiety, I would assume, that happens around that time. Can you talk to me about the impact of postpartum depression, what that might mean for a family environment, or how that really could pose a challenge for women in that time of life?
Well, postpartum depression is much more serious and much more prevalent than people really realize. We've been hearing recent stories about women who, of course, the worst part of it is that one of the symptoms is that you can feel suicidal and want to harm yourself or harm your baby. Also, there's sadness, there's crying, there's a sense of not being able to bond with your baby. There's sometimes anxiety. There are a whole bunch of symptoms. Really, though, postpartum depression is a type of major depression. And the truth is that there have been antidepressants used to treat postpartum depression for years, particularly the SSRI is a class of antidepressant. So it's not like, it's not exactly that this is the only kind of treatment that women with postpartum depression can have. The main problem with treatment is that women feel ashamed. They don't want to admit that they're having depression. They think that this means that they're a bad mother. They should be thrilled with their baby, and if they're anything less, they feel guilty about that. So women need to go to their doctors. That's the key, not just that they need this new antidepressant.
Appreciate you both coming on. Thank you for your time today.